Hello, welcome to Forme. This is our first Facebook Live. Our mission, your health, and I'm Dr. Gary Midelton. I'm the internist here and also the medical director. So I'm pretty much in charge of primary care and health maintenance. And today we're going to be talking about cholesterol, the good types and bad types. So there's different types of cholesterol. A lot of people think that the cholesterol comes with symptoms, dizziness, sometimes blurry vision, headache, fatigue, and for the most part, that's just not true. So these are what I guess you would consider some of the silent killers, and you don't know you have a problem with cholesterol very often until it's too late. Sometimes the first sign of high cholesterol may be a heart attack or a stroke, which of course by then you don't want to be first treating it then. We like to treat these things way ahead of time, and so that strokes and heart attacks don't happen. So a lot of it is the types of cholesterol and your cholesterol levels can be affected by many different factors. Certainly some are genetic factors, which means you're going to be predisposed, and of course a lot of it has to do with lifestyle, and very often we will start with lifestyle modification, weight loss, exercise, eating healthy, and diet to try to lower your levels. And if it's not possible, we start medications. So there's two different types of medications that target the different types of cholesterol. And there is a type of cholesterol that's healthy. So generally have the bad cholesterol, which is the LDL. We have something called chylomicrons, but there really aren't any medications to treat that. We have triglycerides, which you could think of as the fat that's in your blood. And then there's HDL, which is the healthy type of cholesterol, which most people will find that if they start losing weight and working out and running, doing good cardiovascular exercises, that type of cholesterol begins to increase, and that's exactly what you want. So as a matter of fact, when we read cholesterol profiles in the blood, the whole number very often doesn't really tell us anything. You really have to look at the breakdown, because someone who has high cholesterol, just by the number of the total, if that number may be driven up by the HDL or the good cholesterol, well then it's good if the cholesterol is high, because a lot of it is coming from the healthy cholesterol. So the total number doesn't really mean anything. We have to look at the bad cholesterol, the triglycerides, the chylomicrons, and then we target those with different medications, and of course, as stated before, diet and exercise.
So is it a good idea to take pills to lower the cholesterol?
It's a very good idea to take pills. Of course, you have to be monitored. If you need it, you should take it. And of course, if you can't change it by yourself with just diet and exercise alone, then yeah, you should take it. One of the problems I often encounter is a lot of patients, for whatever reason, and maybe it's partly my fault, and maybe I don't express it correctly, is that usually when we start these medications, a patient will come back months later and say, well, I say, what happened? You're not taking the medication anymore. They say, well, it finished. Well, it's not supposed to finish, because these are some illnesses that don't really have a cure. So if you can't lower it by yourself with diet, exercise, and weight loss, then you really have to be on the medications for life. And it's not a punishment, but we give these to people to extend life with minimal or hopefully no complications. And By that I mean we're trying to prevent heart attacks and strokes.
So what happens if your cholesterol keeps being high and for a long period of time?
Well, I mean, if you have it for a long period of time, you can get a heart attack, you can get a stroke, so which a lot of times can be, you know, if you get a heart attack, you sometimes die. There's no treatment for death still. I don't think there will be anytime soon. So that's pretty bad. Certainly you don't want to get a stroke. There are people who get mini strokes and strokes that they do get better from, but certainly there is a large number of people that get strokes and they do not recover any of the function that they have lost, and that can be just very, very crippling if you can imagine having to be in a wheelchair for the rest of your life. So that's why in the big picture, when we do prescribe medications for these, and we do ask people to lose weight and try to change their diet, and again, sometimes you just can't. There may be, excuse me, a genetic component. The medications, again, I'll say it again, they're not punishments. We're trying to stave off illnesses. We're trying to help and, like I said, prolong life.
So why we see some kids with high cholesterol and what they can do to lower the cholesterol when at the age of 8 or 9?
A lot of time, what's happening now is there is an epidemic of obesity. So children are being they're getting lazier. There's more video games. People are not going outside. They're certainly not eating healthy, and they're gaining weight. And unfortunately, with weight gain will often come its three friends: high blood pressure, diabetes, and high cholesterol. So that is apparently what's happening. So the best thing to do if the patients are starting that young with high cholesterol, chances are it's going to be tied to being overweight and eating poorly and inactivity. So certainly you don't want to start someone that young on lifelong medications. And I'm not a pediatrician. I don't know that you would that you know, these medications are not really for kids. So you know, the first thing anybody wants to do, and like I said, even as an adult, before you commit somebody to a lifetime of medications, we first want to start with diet and exercise and basically lifestyle modification. And certainly it's usually easier to do those as a child sometimes than it is an adult. But the reason it's starting earlier is, unfortunately, we have an epidemic of obesity in this country.
So what are the mistakes as an adults we make in our lifestyle that lead us to have like high cholesterol?
The mistakes that adults often make, well, number one is not checking. That's the first mistake. At least when you're a child, your mother or father, they have to take you to the pediatrician to get your vaccines, and you're getting physical exams while you're there, and eventually somehow, somewhere, one of the doctors at some point, your pediatrician will draw your blood. But when people often become an adult, they seem to just not take their health as important, and because there's no signs or symptoms very often of cholesterol, they don't come in and get checked. So the first thing that we would want to do is just make sure that, you know, you're getting checked, and that's the first correctable mistake. So once we do that and we can see if the cholesterol is high or not, then you need a conversation with your doctor to figure out, well, why is it high, and what can you do to reverse it?
Some people don't even know they have high cholesterol. So how do they know there's some symptoms or some feelings or something that help you to find out do you have high cholesterol without even measure it?
No, there's absolutely nothing. There is, that's almost true. That's 99% true. There is one type of rash, it's incredibly rare, that does come with cholesterol that very often if we see it, we will automatically just draw the cholesterol levels and tell the patients. But it's a bit rare. It's a very specific kind of rash. It doesn't itch. It usually comes out around the eyes, and we can often tell that your cholesterol is high just from that. But other than that, and like I will repeat, that is an incredibly rare phenomena of very high cholesterol. Other than that rash, there is no sign and there is no symptom. You will not feel dizzy from high cholesterol. It doesn't give blurry vision. It doesn't cause dizziness. It doesn't cause fatigue. It doesn't cause a headache. It doesn't cause a fever. Unfortunately, it is one of the silent killers, because, as I said before, the first time you'll know that your cholesterol is high could be with a stroke or a heart attack.
So what are the worst foods you can have when you have high cholesterol?
The worst foods, very fatty foods, fried foods, saturated fats. Fast food is a big one. Those are the things you want to avoid. Certainly, it's also linked to a lot of starches, a lot of processed sugars. So white flour, white pasta, white bread. So a lot of times for cholesterol, specifically triglycerides, whole wheat breads and multigrain breads are better. Even organic sugars are going to be better. Organic rice is going to be better. Organic pastas, whole wheat pastas, organic or whole wheat tortillas. Basically, it's the white processed sugar that can drive up your cholesterol. And certainly alcohol and beer is certainly considered alcohol. So you should really cut back on these things.
So what's the difference between triglycerides and cholesterol?
Well, triglycerides is just one of the types of cholesterol, and that's more like the fat, the fatty component or the fatty part of the blood.
So we have Michelle Santiago who is asking, what are your thoughts on the ketogenic diet?
Well, I'm a big proponent of the ketogenic diet, which is really an almost no carbohydrate or a very, very low carbohydrate diet. That seems to, the first thing it does is when your body goes into ketosis, you start to burn fat. And when you're burning fat, you're losing weight. And in the process of weight loss and in the burning of fat, your cholesterol lowers. Diabetes can improve. Pre-diabetes can completely reverse. You're going to lose weight, and if you have high blood pressure with the weight loss, that will often reverse, and high cholesterol often reverses as well. So I'm a huge proponent of a ketogenic diet. I don't know that you want to do it forever. However, it's certainly very helpful to initially lose weight, but you always have to be careful, because when you start reintroducing carbohydrates again, you're going to start to gain weight again. So you always have to, whatever you're going to eat still has to be with moderation. And it's really, I always tell patients not to look at it as a diet, but more of a lifestyle change.
So is this diet like healthy, or it could be like secondary effects in the future, in the long term?
There's no secondary effects at all. That, to my knowledge, has never been proven. I don't even know if it's ever been raised as a question. As soon as you introduce carbohydrates or sugar again, you're no longer going to be in ketosis. So no, you can do it. There are people who do it for very long periods of time.
So what kind of test do you recommend to people to make every year? So what is important when you want to take care of your health to do?
At least once a year, you should have what we call an annual physical or well visit. Blood pressure has to be checked. We do a height and weight and get the body mass index. Cholesterol will be drawn. We encourage people to do that fasting. Some people will say you don't have to be fasting. I have read that. However, in my experience, that does not always work. So I would still recommend to be fasting when you do that. Blood pressure will be checked. Of course, then comes the blood work, and if there's diabetes in the family, anyone who is obese will usually check what's called a hemoglobin A1C, which can help us detect diabetes or pre-diabetes. And we will see the types of cholesterol, and then should anything be abnormal, a diet and or medication can be tailored.
So to finalize, what will be your recommendations to keep your cholesterol low and avoid, like health issues in the future?
Well, certainly prevention is the best medicine. So definitely everyone should get a yearly physical. Everyone should have these blood levels checked, and a healthy diet. Anything in excess is certainly bad for you. And one of the easiest things to do, and everyone understands it, I don't have to go into anything complicated, any complicated regimen explaining anything. Cut the junk. Just don't eat the junk, and everybody understands that.
Okay, thank you, doctor.
Okay, thank you.